This is just unbelievable. So the Minister of Health paid a surprise visit to the Rich Hospital, and he discovered that MRI scanners, CT scanners, washrooms, and some other facilities within this hospital were not functioning for the past 2 years. If you don't know what MRI scanners and CT scanners are, this will help you to understand what they are and what they are used for. Now, the funny part was that the manager in charge of this facility was playing ignorance, or he was trying to prevent the minister from knowing that these facilities are not working. But the minister was fast enough to tell him that you are the manager of this facility. You are supposed to know what is happening.
Yes, the facility manager is our one. That's here. So what's going on? You are not even aware this one is locked. No, you are not.
So, like you said, they came around yesterday to come and verify. So we are going to work on it.
And when we met you, they said that's why you told us. So you couldn't even tell us at that time that,
I thought you said you wanted to see the washroom.
Yes.
Yes, so this is the washroom.
Where is it?
This one.
Why is it? Is it this one? What is this?
This particular one.
So I don't have access to it.
So unless they will finish for you.
And so you must know, you are in charge. So you must know the development here.
Right.
If it is 40, you must know.
Right.
So what it means is that today, as I speak to you now, all these patients, if they want to go to the washroom, what will they do?
We have one suggestion that they can use.
Let's go. Just 2 minutes.
I
can imagine a patient in the facility who wants to use the washroom.
Show you. No, the washrooms are actually, I'm a clinician, I work in the space.
So that's why it's locked down. So you got the last on the other side. That's for PD. Let's see that one. We are just going at random.
No, but very come. You know, when was they locked yesterday?
So these doctors, nurses, and some other people that work within these hospitals, they have their own clinics, private hospitals, private laboratories, and private pharmacies. So when you go to the hospital, let's say I go to the hospital and I want to run a test, instead of using the government facility, which is less costly, they will ask me to go to a particular laboratory to run that test, which is more costly. Or maybe I want to take a drug. It is not at the government pharmacy, but in their own pharmacy, it is there at a very high cost. That is what they are doing. So if these MRI or CT scanners are working in the government hospital, they are not going to make their private money. So they will prefer to allow it damage. They can even spoil it on their own for their benefits. It will be lying there. So anytime somebody is going to use a MRI scanner, they will say that, okay, go to this hospital, go to this private hospital, go to this clinic, for them to make their money. How wicked can you be? If you know the government is not paying you well, stop the job and go and concentrate on your private hospital, pharmacy, clinic, or laboratory. Don't combine the two for your own benefits. You are very wicked. Be informed. So these doctors, nurses, and some other people that work within these hospitals, they have their own clinics, private hospitals, private labs.